Floor of pharynx. Endoderm at the foramen cecum gives thyroglossal duct to form thyroid gland in the midline. Parafollicular C cells in the thyroid gland are derived from neural crest cells from the ultimate branchial body. Thymus and parathyroid gland develops from third pharyngeal pouch. DiGeorge syndrome. Third pharyngeal pouch is missing. Thymus and parathyroid gland are missing. Thymus is absent. T lymphocytes are missing. The baby may have severe bacterial infections. Parathyroid gland is absent, therefore deficiency of parathormone, therefore hypocalcemia, leading to cardiac abnormalities. First pharyngeal cleft forms the external auditory canal lined by ectoderm. First pharyngeal pouch forms the tympanic cavity, middle ear cavity, and eustachian tube. At the junction of first pharyngeal cleft and first pharyngeal pouch is the tympanic membrane. Tympanic membrane, outer epithelium derived from ectoderm of first pharyngeal cleft. Inner epithelium derived from endoderm of first pharyngeal pouch. Connective tissue derived from secondary mesoderm, derived from neural crest cells. Palatine tonsil is formed by secondary mesoderm, derived from neural crest cells. Tonsillar epithelium, however, is derived from endoderm of secondary pharyngeal pouch. Heart. Two heart tubes fuse to form a single heart tube in the midline. This heart tube has one arterial end called truncus arteriosus. Truncus arteriosus pushes the blood into aortic sac, which has right and left horns. This right and left horns of aortic sac push the blood into right and left aorta, which run near midline. Right and left aortic horns push the blood into sixth pharyngeal arch arteries on either side in the head and neck region. Pharyngeal arch arteries push the blood into dorsal aorta on either side. Right and left dorsal aorta eventually fuse in the midline inferiorly to form single midline aorta. Pharyngeal arch arteries finally form the carotid arteries, subclavian arteries, arch of aorta, pulmonary arteries. First arch artery, it disappears and leaves behind part of maxillary artery. Second arch artery, it disappears and leaves behind part of stapedial artery. Third arch artery, it persists in adults. It contributes to form common carotid artery, internal carotid artery on either side. Fourth arch artery, right fourth arch artery, forms a part of right subclavian artery. Left fourth arch artery forms a part of arch of aorta between left common carotid artery and left subclavian artery. Fifth arch artery, it disappears in adults. Sixth arch artery, it contributes to pulmonary artery on either side, ductus arteriosus. However, right ductus arteriosus regresses. Truncus arteriosus eventually divides into an ascending aorta and pulmonary trunk. Distal part of right dorsal aorta disappears. Arch of aorta is contributed by left dorsal aorta. Arch of aorta is contributed by aortic sac, left horn of aortic sac, left fourth arch artery, left dorsal aorta. Right subclavian artery is contributed by right fourth arch artery, proximal part of right dorsal aorta, right seventh intersegmental artery. Left subclavian artery is formed by left intersegmental artery. Embryonic adult aortic arch arteries. Embryonic 1 adult maxillary artery. Embryonic 2 stapedial artery. 3 right and left common carotid arteries, right and left internal carotid arteries. 4 right subclavian artery, arch of aorta. 5th regresses in humans. 6th right and left